HealthEd is Australia's leading provider of quality clinical education for doctors and other healthcare professionals. This episode has been made available on Spotify and Apple Podcasts. For free access to the full library of podcasts and to claim CPD for listening, visit healthed.com.au or download the HealthEd app.
In today's episode of The Clinical Takeaway, I will be speaking to Dr. Kate Wylie and Simon Eccleshall on climate change, a global health and humanitarian crisis. What must be done to prevent further escalation? Experts, tell us about yourselves.
Thank you very much for inviting me along to your podcast. Yes, so my name is Dr. Kate Wylie. I'm a GP. I work in suburban general practice in Adelaide, and I'm also the Executive Director of Doctors for the Environment Australia, the leading medical voice on health and climate.
Thank you, Kate. And Simon, tell us about yourself.
Yes, hello, David. Lovely to join you and Kate on this podcast today. My name is Simon Eccleshall. I'm currently the head of programs for Médecins Sans Frontières, or better known as Doctors Without Borders in Australia. And I come from 30 plus years of working in humanitarian emergencies and crises all over the world for a number of different organizations.
Simon, it's really interesting that you're from Doctors Without Borders, because today we're looking at climate change is a global health and humanitarian crisis, what we need to do to stop it spiraling further. Now, to be honest, Doctors Without Borders doesn't seem to fall into my radar screen when I think about climate change. So tell us about why it's important for Doctors Without Borders to be involved in this important issue. And what's the link between climate and health?
Exactly. Climate change is increasingly being recognized as a global public health emergency. So that really positions it as core business for Médecins Sans Frontières, for Doctors Without Borders, who responds to health crises globally. If we consider that climate change is no longer a distant environmental issue, it's a real present-day global health and humanitarian crisis that MSF is seeing through all of our projects globally on a day-to-day basis. We're seeing it drive displacement. We're seeing it create food insecurity. We're seeing changing patterns and emergence of new diseases, and it's amplifying the inequalities that MSF typically responds to. If we quickly look at the climate-related health impacts that have been included in the IPCC, or the Intergovernmental Panel on Climate Change's most recent assessment, they're highlighting four key areas where they have a high to very high level of confidence on the links between climate change and health. And I'll just touch on those four quickly as a way of sort of framing the rest of our discussion today. So we've got heat-related illness and death. This is happening as a result of rising average and extreme temperatures. And we're seeing evidence for this in our MSF projects, the increased mortality and morbidity, particularly amongst the elderly and amongst vulnerable populations. A second area is malnutrition. We're seeing increased levels of drought, which is resulting in crop failure, reduced agricultural productivity. This affects child growth, it affects food security, and particularly in regions around the equator where there's more fragile food security systems. Thirdly, an increase in waterborne diseases. This is a result of flooding and water contamination. We're seeing increased levels of cholera, diarrhea outbreaks following extreme weather events and rainfall and infrastructure damage associated with that. And then lastly, vector-borne diseases. The warmer weather is leading to changing patterns of precipitation. We're seeing seasons starting earlier and finishing later, which is having an impact on extending the range of diseases like malaria and dengue and other vectors. So they're just four examples of why this is core to MSF's work.
Thank you, because it's really important to hear that work being done globally. I really would like to come to you now, Kate, and ask you, having heard what Simon's doing with the Doctors Without Borders, how does that impact the work of Doctors for the Environment? And secondly, what does it mean for our GP's listeners as we hear all these issues being brought up?
Yeah, sure. Thanks for that, David. And, very much agree with everything that Simon's put forward there. For us in Australia, though, we are certainly having our health being impacted by climate change. And for GPs, the work we do, we are having our patients' health be impacted by climate change. Now, Doctors for the Environment, we started in Adelaide actually. We've been around for 20 plus years, and we're all about volunteering our time for emissions reduction, protection of biodiversity and sustainable healthcare, to further the need to treat climate change and to move us on from the cause of climate change, which of course is our over dependency on fossil fuels. But to go more directly to your question, what we are seeing in Australia is very much the stuff that Simon's talking about, especially in the top end when you think about, the health impacts for anyone along the equatorial belt and the Torres Strait. So, the Torres Strait is drowning under a rising ocean. And they have high impacts of the infectious disease profile up there, TB,
Mm,
dengue
mm,
fever, and then we've got the floods in northern Queensland with the melioidosis outbreaks that we've had up there. But, for someone like me, I'm in Adelaide, so right at the other end of the country. But what are we seeing? We've got a drought. So we've just had a big, long, hot summer where our farmers are in drought. We're having problems with increased cost of living associated with food. And that means, again, social inequities around that.
mm,
It means water insecurity. So in the Adelaide Hills, we have people having water trucked in. And and of course, that's an awful thing, right? And then the most devastating thing we've had this last summer is we've just had an algal bloom
mm,
where the beaches around Adelaide have got rotting marine life basically on the beaches due to an outbreak of an algae brought on by a marine heat wave.
mm.
And that means that you can't swim, you know, people aren't surfing. The respiratory impacts are mild and transient for well adults, but if you've got an underlying respiratory condition like asthma, COPD, cystic fibrosis, any of those things, those patients are more in danger. So even though we might see ourselves in Adelaide in Australia as having good healthcare, which we do, like we are a very fortunate country, we are certainly increasingly seeing it in our lives as working doctors. And it means as working doctors, we need to have our eyes open and be prepared.
Kate, one of the difficult things with GPs, and I'll just put it to you because you are a practicing GP, is that we see these issues and in our discussions with the patients about what they're suffering and what they're going through. I just wonder in how many discussions do we say, and this is a result of climate change?
It's a hard thing, right? So let's face it, every GP in Australia is time poor, they're pressured, they're running small businesses, they're trying to do everything they can to service their community. And, I think, general practice is a fabulous job and we all do great work. The way I approach it is I consider climate change as a risk factor. So if I'm talking to a patient about asthma, a patient with asthma, talk about the impacts of climate and pollution on their asthma. So if they have gas in the home, that's going to increase their risk of asthma exacerbations. When there's a fire and the smoke, I mean, the smoke obviously is bad for respiratory health. We have increases, more pollen associated with climate change. Then there's thunderstorm asthma, etc., etc. So I incorporate
Mm,
it
mm, mm,
in
mm,
rather than trying to put it as another add-on.
mm,
Mental health's another great
mm.
example there where, you know, obviously in general practice we see so much mental health and the mental health problem is a big one. And I just screen for climate with my patients and all I say is, are you worried about your planet? And people say yes. Not everybody, some do.
Well done, because clearly some of the patients need to know so that they in the future may want to get involved as well. I'm just wondering, having heard from Simon, do you even bring up the global issues so that our patients start to develop a broader view of how this disaster, this crisis is affecting outside of our borders? Okay. Do you talk to your patients about opening their eyes to the work that Simon's doing?
Oh, it depends on the patient. The patient is in the room for their own health care. So I'm not there to, really push these on people. But there's a lot of people who are very happy to talk further in general practice. So, often we have chats. And, when you say to someone, are you worried about the planet? And they are, and lots of people are. And I know we always think young people are, and young people definitely are, but elderly people often are also. And I meet a lot of older people who talk about their worry about what we're leaving for their grandchildren.
Mm,
Yeah, and we shouldn't forget that
mm,
those people are there and aware.
mm,
And then, then we start talking about the global health
mm.
problems and, what it means for anyone, across the equatorial belt, the impact that our politics are failing us here, where we're continuing to expand gas, where the international markets, need to be doing better, drill, baby, drill, all of that
Yeah.
sort of stuff. And those conversations do come up, absolutely.
The reason why I ask is because our patients, once being informed and empowered, we need as many people on board working for this issue.
Completely agree.
Back to you, Simon. How is this climate change affecting the work of Doctors Without Borders?
In many ways, but before I describe those, I think I just want to pick up on a few points there
Mm,
that Kate
mm,
was raising. I think, and you, that Australians are really worried about the planet, and we see at MSF an increased interest in medical personnel, in doctors and in nurses wanting to work with MSF in
mm,
context overseas and to bring that knowledge from working inside a well-functioning health system in Australia to some of those really intense conflicts and crises globally, where we're seeing how climate change is driving more complex and more interconnected health emergencies. So for MSF, climate change, like in Australia, it's a risk factor, but for us, it's a risk multiplier. We're seeing events like floods, droughts, and heat waves creating cascading and compounding impacts. So we're seeing one hazard trigger another set of health risks. So, for example, flooding can lead to displacement, it can lead to water contamination and outbreaks of diseases like cholera and dengue.
mm,
Droughts can reduce access to food, leading to malnutrition, which then worsens outcome for common infections. A
mm,
lot of the patients MSF sees don't have that level of resilience that many of us do in Australia.
mm,
They're in a weakened physical state because of the context and access to nutrition that they're living in. So these layered impacts are really increasing demand on what we know is already a stretched health system in many of the places where MSF is working. If I turn to a couple of examples, in South Sudan and in the Sahel, we've seen over the last couple of years that drought has really driven higher rates of malnutrition.
mm,
And then if we go a little further south than that in Africa, Mozambique and Madagascar have had a number of fairly unseasonal cyclones, which have led to mass displacement and then led to cholera outbreaks. So MSF's observing this sort of interconnected level of health crisis, changing geography of and seasonality of some of the hydrometeorological disasters, and which then in turn are driving changes in disease vectors. So that's very much affecting MSF's work. It's becoming a concurrent theme throughout everything we do.
And for you, Kate, you've already mentioned some of these issues that you actually see from, the
Mm.
increased pollen to melioidosis with the floods. Slightly different issues locally because we don't have this malnutrition issue and the displacement issues, although
Well, we
in
do
the
have some displacement. I just did want to pick up on what Simon said there, because you think about the communities around Lismore
Mhm,
with Lismore floods, we
mhm,
still have people experiencing homelessness there.
yeah,
When we think about remote communities in the centre of our country, we have people who are finding it's too hot to live in remote Aboriginal communities. That's impacting on the health workforce. We know that there's work where people have left Northern Territory Aboriginal Health Services and citing climate change as one of the reasons why they don't want to continue to work there, because it's just too hot. So, displacement is certainly still a part of us here in Australia. And of course, we must not forget that the Torres Strait is part of our country. And for the Torres Strait Islanders, they are having, they really are in trouble. They absolutely, their land is drowning. And so they have displacement as well. So I think it's one of those things that as we have more compounding disasters, as Simon points out, we are going to have more and more people impacted by there's the heat wave, and then there's the fire, and then, where do these people go? What do we do with that? And, when we have, Darwin has been called a sacrifice zone, which is a terrible term, but, what happens to these people? Where do they go? And yes, so Australia will have to deal with displacement internationally, but also displacement internally. It's going to be part of what's coming for us.
Kate, thank you for actually correcting me because, I have friends out at Lismore and they are impacted.
Mm.
But the Torres Strait Island issue is very hard to see because it's not often spoken about.
Yeah, it is. It's sort of, well, I suppose it's out of sight, out of mind, and it's certainly, well, for me in Adelaide, it's a long way away, but
Yep.
very important for the people who live there.
So it's really important that you all speak about this to keep it in our minds.
Yeah.
Now, back to you, Simon. You have given me some examples of MS, Doctors Without Borders response to climate-related crises. Are there others that you would like to share with our listeners?
Yes, certainly. I'd really like to talk a little bit about an unknown country relatively in our own backyard, which is the Pacific island nation of Kiribati. This is a country that many people might already be aware is one of the world's most climate vulnerable countries. Most of the small amount of land available in Kiribati is a few meters above sea level, so it's extremely vulnerable to rising sea levels. So in addition to rising sea levels, Kiribati is suffering from extreme weather events. We're seeing water contamination there, fresh water contamination by salt water, a loss of arable land, which is related to that. And interestingly, we're already seeing health and well-being impacts on the people of Kiribati. And so Médecins Sans Frontières, Doctors Without Borders, has been working in Kiribati for the last couple of years. We entered there in 2022 to support them during the COVID crisis. And we've been looking at the health impacts on mothers and children in particular. We've noted there's increased risks of infant and maternal death. There's pregnancy complications. There's climate-sensitive diseases which are gaining in prevalence. And so we've started a project in Kiribati specifically designed around helping to adapt to some of those major challenges posed by climate change. Some of the things that we're doing that might interest the listeners, we've adopted a more community-based model of care. So we're partnering with local leaders and communities to ensure that they're involved in the decision-making around the changes in livelihoods and lifestyle that will accompany their future prospects living and working in Kiribati. We've been working with the pharmacies at the major hospitals there, looking at medical waste, expired and unused stock, supporting national essential drug list and better stock controls. That's also then able to perhaps streamline and improve the logistics into and out of Kiribati for medical supplies. Healthcare waste management more generally, looking at waste disposal on a small Pacific atoll where there's a minimum amount of land for safe disposal. And so we're looking at waste management, technical expertise and new practices in that area. And then lastly, we're supporting the Governor of Kiribati to rehabilitate drinking water wells, repairing rainwater harvesting systems, and supporting community-managed water management systems that will directly benefit mothers and children. So that's a good example of some of the new ways that MSF is working in new places, directly combating the health impacts of climate change.
Never thought about it. Completely under my radar screen, Simon. Thank you for informing me. Kate, I suspect our brothers and sisters up in Torres Straits would experience something similar.
Yeah, absolutely. I think any island nation, really, anyone on the Pacific, we talk about Pacific nations all having these problems of rising sea levels, being exposed to extreme weather, and the obvious impacts on health.
But are they experiencing any of the degree of the comprehensive kind of work that the Doctors Without Borders are giving to Kiribati?
I don't know if MSF are in the Torres Strait or not, but I'm very happy to hear what you're doing in Kiribati there, Simon. That was a really heartening thing to listen to. But yeah, the same kind of problems are there in all the island nations. So, they're the canary in the coal mine, to, put it in a sort of an easy way to understand. But I suppose the point is that because we can see that this is happening, And we can also see the impacts on our own working lives, no matter where you're living or working in Australia. If we have increased heat and heat waves and the impacts of that on health, and heat-related illness is a massive problem. Heat causes about, was it 3,000 deaths a year from heat-related illness in Australia? And then there's, the increased heart attacks, stroke, kidney disease, mental illness, suicidal ideation, domestic violence that we see associated with heat. There's the smoke and the fires and the impacts of that, increasing, smoke-related problems, heart attacks and strokes again, COPD exacerbations, the infectious diseases that we've touched on. And, here we have Japanese encephalitis in the Murray, all the way down there where, you didn't used to have to think about that down in South Australia, but we do have to think about it now. And of course, the immense mental health burden that we're seeing all across the country associated with climate and our ongoing dependency on fossil fuels. And I would like us to be able to touch on that, why is this all happening? This is happening because we as a global community continue to be dependent on fossil fuels. We know it is the combustion of coal, oil and gas that is causing the greenhouse gases that are increasing the number of greenhouse gases that are causing global heating. And this is unfortunately a politicised problem, but really it's a health problem with health effects that we're all trying to treat. And so, if we frame it in a public health way, we can bypass the unfortunate politics. Like when it comes to, how do we address the health harms of tobacco? We quit smoking. How should we address the health harms of fossil fuels? We should work to quit coal, oil and gas, move on. Yes, they've done great things for us historically, but we are at a point now where they are absolutely harming the health of our patients, our communities, our planet. And I think as doctors, we have a responsibility to call out that health problem, to frame it in that way and say we need climate action to protect the health of our community.
Wonderfully passionate statement, Kate, and I couldn't agree more. Brings up a few issues here, though, apart from not getting into the politics of the situation. But the two issues, things that you brought up, Simon, and things that you brought up, Kate, two issues. One is inequity, and the other is something called climate justice. So, Simon, maybe I'll come to you first. You spoke about inequity earlier on, and I can see it happening in the poorer nations and those whose countries are more vulnerable to climate changes. But at the same time, there's something you feel is wrong or is unjust about the whole issue. Tell us, what is climate justice and why does it matter?
Yes, David, certainly. And look, I couldn't agree more with Kate as well on the need for Australia to abandon its dependence on fossil fuels as a way for tackling the health emergency that's resulting from climate change. Climate justice, this is a really interesting concept, David. It essentially means tackling climate change in a way that's fair and inclusive. Mm-hmm. And so for MSF, our work is really grounded in climate justice. We're motivated to support those who are least responsible, but most affected by climate change. So our focus is not just on immediate care, but we're also looking at how we build the systems and strengthen health resilience in the face of a changing climate. If we go to how the IPCC defines climate justice, they say there's three things that are key to it. The first is what they call distributive justice, which means sharing the burden fairly across countries and across generations. So that's about burdens like heat waves and floods, and benefits like funding and technology need to be shared equitably or fairly across the different countries and generations. So for example, Australia is a mass producer of greenhouse gas emissions, whereas Kiribati is not. So Australia should be doing more to cut its emissions than poor Kiribati, who is not really contributing to the global greenhouse gases problem. The second area of climate justice that the IPCC highlights is what they call procedural justice. And it means ensuring that all affected communities have a real voice in decisions that impact them. So that's the work that we do, internationally, where MSF speaks out on the needs and rights of our patients and of their communities. And it's about helping them to be able to voice their concerns, speaking with the people affected by climate change in Kiribati, the government of Kiribati, and supporting their voice at international forums. And the third element of climate justice that the IPCC talks about is recognition, which is respecting diverse cultures, knowledge systems, and rights around climate justice. And so if we put those three together, it really does highlight that it is about fairness and inclusiveness when we're talking about the burden of responding to climate change. That some states, some countries need to be doing more, and other countries with less responsibility or less contributions to the problem should be supported and compensated for the impacts that are being caused by others.
Yeah, very, very clear.
This episode is one of hundreds of informative and free clinical podcasts from Health Ed. Access the entire library through the Health Ed app for healthcare professionals, which you can download today from the App Store.
Kate, I'm going to ask you a question. How do average doctors, and maybe even in Australia, or a patient coming to you, how can they understand these three key points?
Well, that's quite a complex question, I think. And because, the different patients that we have that come into our rooms, for some of them, this won't be an issue at all. And that is probably a difficult thing to raise in a consultation sometimes. But what I sort of think about while Simon was going through this is the different vulnerabilities that our patients have.
Mm-hmm.
So heat is a great example of this, where certainly we have patients who are much more vulnerable to the health impacts of heat, and that tends to be from a social justice lens. So people who, homeless people are extremely vulnerable to heat. People who are renting, people who can't afford to pay electricity bills, are much more vulnerable to heat. And us as doctors, we should be cognizant of that. Like saying to a person that can't afford their electricity bill, the best thing you can do is turn on your air conditioner on a hot day, isn't really sort of taking the problem to its fullest extent. Certainly there's other things that people can do to keep themselves cool. Fans can make a huge difference. They're a lot cheaper to run than air conditioners, etc., etc. I think also from us as a profession, what I hear from that is our responsibility to advocate for climate action, because, we can say we are representing the health of our community where we know the vulnerable people are experiencing these health impacts more severely, and therefore we apply a social justice lens to the work.
Sam, I can't help when you were talking about, distributive justice, procedural justice, and the recognition of the cultures and the systems already there. A degree of, I wouldn't say anger, but sadness, terrible sadness. There might be other doctors listening to this podcast feeling also some of the, if you like, strong feelings I'm feeling. Kate has asked us to actually maybe get involved, and one way here is to get involved with Doctors for the Environment. But what can we do as listeners to you, Simon, and to MSF and Doctors Without Borders? What can we do?
There's a lot that doctors and medical professionals can do, as well as the general public in Australia, to help to start to address this huge injustice and this economic imbalance which exists around climate justice and the actions that are needed to save lives. So advocacy is a key part of what MSF does, and by supporting the work that we do internationally, we're looking to mobilize resources and support for the most vulnerable people. So again, primarily that's about saving lives and reducing mortality and morbidity from climate-related health impacts. But it's also about advocating for policy change with governments. It's about raising awareness and giving agency to the voice of our patients so that they can spread awareness of the impacts that they're seeing. And that goes from Kiribati through Asia to all the places in Africa where we're working, where around the equator, the impacts are being felt today and at extreme levels. And perhaps in the governments in countries like Australia and in the global north, there's less urgency and reality. Although you would argue in Australia, as Kate has mentioned, we've had our fair share of extreme weather events in recent years, which puts it front of mind for many of our politicians. But it's still not front of mind enough to influence the way that they're allocating resources. We don't have enough support going to humanitarian aid programs. In fact, we're in a period where some of the world's major donors, including the US and the UK and France, have drastically cut the amount of money available to support humanitarian needs. And we're not seeing through the IPCC system enough concrete progress on that distributive justice and that allocation of resources for those communities most affected by the impacts of climate change from those countries that are most responsible for creating the situation that we're in. And so there's a lot of work to be done there. So holding these high emitting actors like Australia and policymakers accountable for their role in the health harm that is happening as a result of climate change is something that every doctor, every nurse should be talking about when they're talking with their local politician or when they're speaking with other people who are of influence in Australia. For MSF, we need to do more in this area. It's an emerging area for us, and we need to design our medical programs to be more adaptive. We need to be working closer with communities affected to understand how it's changing their vulnerabilities and what we need to do better to make our projects more climate resilient in the future.
Yeah, so picking up on what you're saying there, Simon, Doctors for the Environment is very much involved with advocacy and, standing up for our patients' health by addressing the health harms of climate. Currently we have a judicial review that we've lodged with the High Court. We're asking the court to re-examine the regulator's approval of the Scarborough Gas Environmental Plan, because we're concerned about, fundamentally we're concerned about the health impacts of offshore gas on our patients. And so that's something that DEA is pursuing at the moment. We write a number of reports and fact sheets. We launched our Fossil Fuels Health Hazard Report at Parliament House last August, which highlights how fossil fuels damage human health from extraction through to use, through to waste, through the use of plastic and biodiversity loss, climate change, etc. And, I think we touched on the importance of advocating politically, and absolutely we should do that, federal, state and local, and certainly DEA members, some of our active members do a lot of that. We also need to advocate internally with our own work, with our own colleges. I do want to acknowledge that the RACGP has declared a climate and health emergency, and that we have our own climate group in the RACGP that does a lot of great work. But again, the need to make sure that our health institutions are absolutely saying, yep, we will do everything we can to reduce the health harms of climate change, ensure an equitable response for our communities is a really big part of our job.
I just had a thought, Kate, because you did rightly say not all patients might at the same time be involved, if you like, have the awareness, and doctors are so busy. Are there leaflets or are there things that doctors can have in the waiting room that basically the patient with asthma or suffering from some of the effects of climate change, from whether it be drought or floods, they can actually pick it up and say, yes, this is me, I'm one of these people, and allow them not just to know more, but also to get involved and be in their own rights, advocates and involving other people in their community. So do you actually reach out like that?
Oh, absolutely. So if you go onto the Doctors for the Environment's website, we've got like a reports and fact sheets drop down tab. We've got like a resources tab, and like in the fact sheets, we've got one on heat and health and how to stay safe in that. We've got one on gas in the home. We've got one on floods and extreme weather events. We've just rewritten our mental health report, so version 2 of that, which looks at how climate change impacts mental health and the complex things that are happening there. So there's lots of resources there if people want to go on the website and have a look and see how they can incorporate that. That would be really welcome.
Well, this is very practical and something we can do to actually involve them. And I will ask you for those links later to attach to these podcasts.
Thanks, David.
Now, back to you, Simon. What future scenarios should health and humanitarian organizations be planning for?
Yeah, well, we always say you need to plan for the worst and hope for the best, or advocate towards the best result. But we're in a little bit of uncharted territory here around climate change and the health impacts. And so what MSF is really beginning to understand is that all of our future operational planning scenarios need to be built around a bit of a different framework to what we've done historically. So that framework around how we plan is changing. I think first and foremost, the point I raised earlier, we need to be thinking more about compound crises. We need to look at those overlapping disasters and the need for more flexible response plans. So looking at the impacts of extreme heat and flooding for displacement, for food security, for disease vectors in a lot more holistic and complex setup. Secondly, we are looking at something we call operational resilience. So we've noted that our supply chains for many of our projects are not particularly climate change adapted. That when there is an extreme heat event or an unseasonable and severe flood, that our supply chains are not very durable and resilient. So we're looking at how our supply chains can deal with those kind of shocks and be able to work through those events rather than go down and make it a challenge for us to access the resources we need. And that leads us to another area, which is around what we're calling new ways of working. This is really about trying to find sustainable growth models in how we work. So we recognize that humanitarian needs are growing exponentially globally, and that it's unfortunate, but MSF needs to grow, and the whole humanitarian sector needs to grow to be able to respond to those increasing needs. And within that growth captures, the risk that we're going to generate more carbon. So we're looking at how we can decarbonize whilst reaching the same number or more patients than we've done previously. And so it's not a tension between growth versus climate responsibility. We've got to find that win-win. We've got to be able to meet the needs of more patients, those changing needs, in a more carbon-friendly or less carbon-intensive way than we did in years past. And that's really provoking us to be innovative, to look at technology, to look at new ways of working, the efficiencies in our supply lines, where we're moving people from and to in terms of responding to crises. So it's really challenging our old model and enforcing us to modernize and look at the carbon impact of our ways of working. So in those regards, our scenario planning is changing. It's not being pushed by the regulators. This is coming from within. It's coming from an ethical perspective that our doctors, our medical personnel are saying, we want MSF to be climate practice, good practice. We want to be able to look at the ways of working and to be ahead of the curve and to be showing the way, particularly from those countries in the global north where we raise funds, and in Australia and in Canada and other countries. We need to be leading the way and showing by example for the countries and the governments where we work, so that we are, if you like, a champion for climate change, not a slow adopter.
Absolutely fantastic. Kate, this is actually coming straight to you. How many practices in Australia are doctors even aware of our carbon footprint, or whether or not we actually even need to think about it in what we do day to day?
I can't give you an accurate number, David, because there hasn't been the work done on it. But I really want to pick up on what Simon says there about us having an ethical responsibility to act. And when you think about the carbon footprint of healthcare in Australia, we know that is about 5 to 7% of Australia's emissions are because of healthcare. And so that means and globally, healthcare is a big emitter. If we were a country, we'd be the 5th largest emitter. So, certainly healthcare, we're part of the problem, but that means we can be part of the solution as well. And certainly there's things that we can do to reduce the carbon footprint of healthcare. One of the biggest things we can do is keep people well and out of hospital. Okay. So it's hospitals that are by far the biggest emitting sector. A lot of that comes from the energy they produce, but also the way we practice medicine. So keep people well. So great for general practice, because basically we are low carbon healthcare, and preventative healthcare is low carbon healthcare. But also we can look at things like unnecessary tests. So if you look at, like the Choosing Wisely work, which basically talks about, let's not do things that we don't need to do for patient care. There's this sort of rule of thumb that 60% of our healthcare is high value care, 30% is low value care, and 10% is harmful care, which is, of course, a sobering thing to say. One way of looking at emissions in Australia's healthcare has sort of calculated that our emissions, 80% of it is from the way we practice medicine. So that means we can reduce, just by doing our jobs well and avoiding low value care and harmful care, we take away 40% of that 80%, which is like 36%. So that's massive. And so that means we all have a responsibility as clinicians to, practice evidence-based medicine and do well. The other thing we can do as small businesses in general practice is look at the carbon footprint, the way our practices are run. Have insulation, have solar panels, have a bike rack, have an EV charger, all of those sorts of things. Recycle properly. Turn the lights off, reduce the carbon impact of our premises. And I think that's a great narrative as well, because then we show the people in our communities, we as doctors are taking this problem seriously. We are doing whatever we can to reduce the carbon footprint of our own business. And then we're sort of showing the way to the rest of our communities. We're putting our money where our mouth is.
I'm just wondering, Kate, you said that the RACGP is actually quite involved in this sector. Is there a chance that practices can voluntarily sign up to a kind of a carbon footprint accreditation thing where we subject ourselves to a series of benchmarks that we ourselves may want to choose to do? That's just a question for you.
Well, that idea, I've heard that idea a few times over the years, David, and I think it's a wonderful one, sort of a little bit of friendly competition there. Certainly the RACGP has a greening general practice guideline that you can find on the website. And the accreditation standards that are, we're about to get a new lot of standards, and I know that there will be accreditation requirements. And there's two levels. There's the mandatory, and then there's another word for desired or something like that. I don't have the word quite correct. And that includes various sustainability plans that practices can have, which, I think that's a wonderful thing. Let's show the way. Let's be leaders.
And the other thing that we don't actually have is, again, off our radar screen, the numbers of radiological examinations, how much electricity is being used for an MRI, CT scan, and therefore how much it adds to the carbon footprint, how when you do a blood test, the reagents and the disposables, we just don't actually think about these sorts of things. But once we are more aware, it could sit in our consciences. And so I'm just wondering whether your organizer, have you got a list?
Yes, I can send you some links actually, because there has been work on this, where the carbon impact of like 1,000 full blood counts is like driving a 4-cylinder car 700 kilometers.
Right.
The MRIs are the most carbon intensive form of imaging, which isn't surprising, right? But certainly the MRI. So do we really need it? I remember at med school that thing of you don't do an investigation unless it's going to change your management. But I do sometimes think we may order things that that might not really change our management. And I just, I think we're all humans here. And, like the classic one is that one Ventolin puffer. So one Ventolin inhaler, because they're highly potent greenhouse gases that propel the inhalers, is the equivalent of driving a 4-cylinder car 300 kilometers.
What?
Yeah. Whereas the dry powder inhalers, it's less. So a Ventolin, it's 16 milligrams of CO2 equivalent per puffer, whereas the dry powder inhalers, it's less than 1. And that brings us up to another really important thing for people to understand about being responsible in this way, is that often things that are good patient management are also good for our planet and good for our hip pocket. So like with the puffers, if our patients with asthma, if their asthma is well managed, they'll be on a preventer, which means they will be on an inhaler with a lower carbon footprint. So that will save some carbon. It'll be good for patient care. And because that means less asthma exacerbations requiring escalation of treatment, it saves the health dollar money as well. And so patient, planet, pocket, win-win-win.
I'm really enjoying these discussion with you because it makes it very, very practical. But Simon, it's also really interesting to hear that all the things you speak about that MSF is doing on a global level and the way you're thinking through your operations and what you're doing and the sort of cumulative issues that come from even one disaster created by climate change, we got to be able to start talking as a GP community about these sorts of things so we see things wider. But with you, Kate, we need to see things a lot more detailed and specific. For example, when was I ever told that one should reduce MRIs not because we don't need it, or that we're using up public money that really shouldn't be used up? And when would we ever say, my gosh, that's like driving a four-wheel drive for 600 kilometers or something like that? I mean, it's just never a discussion, but can be.
Yeah, I think, certainly climate change has now been included in the curriculum for medical students, and it's getting into the curriculum for specialist trainees. But, so many of us as working doctors, when I went through medical school, this wasn't on the radar at all, and so, I think there's a lot of our workforce who's received no training whatsoever in climate change and human health. And yet here it is, this huge global health problem. The World Health Organization names it as, the greatest public health problem of our century. And yet most of us receive no education on that, which, that's a problem. I would like to see, personally, I think that every health practitioner in the country should have education around climate change and health and get us all up to speed as quickly as we possibly can.
On that note, I'm going to bring this discussion toward an end and come first to you, Simon. Thank you for being with us. What are some of the key messages you'd like to leave with our GP listeners?
Thanks, David. Yeah, look, I'd like to just pick up on that last conversation there with Kate, because I think what we've highlighted in this podcast are the links between the local and the global, and that we need to be thinking more holistically about that. So the conversation we've just had about the need to train Australian medical personnel, Australian doctors in the impacts of climate change will have a flow-on positive effect for the work that MSF and others do internationally. It's developed countries like Australia where we develop the good practice models, the new technologies, the new mindsets that help to deliver efficiencies in the field. So a good example of this is some work that MSF has been doing over the last couple of years, looking at medical consumables and medical waste and things like reusable masks and gloves and gowns as opposed to disposable masks and gloves and gowns, and deeply looking into the life cycle carbon impact of those products and making a very solid case on the basis of evidence in the UK and in Australia and other places for being able to transition to a more sustainable way of using medical consumables in the field. So it's that link between the systems, the practices, the behaviors that we develop in developed countries that then flow on to enable developing countries to leapfrog over some of the mistakes of the past. And that's really important. That's why sending Australian doctors and nurses to the field is so valuable, because they bring that knowledge and that expertise and that awareness of a different side of the problem to a different context. And it helps us to then connect the global magnitude of the health impacts of climate with some of the more refined approaches that we can develop in an advanced and a well-functioning public health system like we have in Australia. So that's one of the conclusions I wanted to leave the listeners with, that there is an undeniable connection between local and global, and we need to be acting locally, we need to be thinking globally and understanding the global impact of our local actions. The other points I really just wanted to touch on quickly is that we are moving into uncharted territory around risks and shocks. The extreme weather events that we're seeing, the impact of a more than 1.5 degree increase in global mean temperatures is unknown. But we are planning for and expecting quite catastrophic changes to the patterns of vulnerability and need for people in the coming years. Interestingly, the World Bank themselves have estimated that it's over 260 16 million people that they anticipate will be displaced by climate change by 2050. And if we take that modeling back to just 10 years from now, that's more than 100 million people from areas around the equator will no longer be able to practice their livelihoods. They'll be displaced further north and further south. And we're going to have to respond to that massive human migration, that massive humanitarian need in the coming years. So that's an impact of the severity of the problem, or the scale and the magnitude of the problem that we're facing. The last couple of points, we need to lead by example. Australians are really respected around the world as being responsible, thoughtful, innovative in having these discussions. We can connect the reality of the situation in Australia and the debates that we're having around energy and around fossil fuel use and around government policy with a global dilemma. And Australians need to have that voice. We need to speak up. We need to push others for action. We need to lead by example. Mm-hmm. And in leading by example, what we're pushing for is system level change. We need to tackle this issue that we touched on today of climate justice. We need to make sure that the burden and the responsibilities for addressing climate change are fair and equitable, that countries like Australia step up and do more than countries like Kiribati that haven't got the resources and the capacity, but are feeling today the impacts of climate change.
Thank you so much for those messages, Simon. What about you, Kate?
Yeah, I think, what we've spoken about today is a really hard topic. And I would imagine some people listening might be feeling a bit overwhelmed and finding this, hard. And, it means, it is hard for everybody. And one of the problems is that we don't want to look at it because it seems too big and hard and overwhelming. And there's also that concern of, well, I'm just one little person. Why would my actions make any difference? But my answer to that is that all of us need to be involved with the movement for change, and that what we do matters. And, if you think about this as a systems problem, and what do we have with systems? We have lots of interconnected parts. So if I'm an interconnected part, then I can make a positive difference in the world around me and so forth, and so can everybody else. So I think that's one thing to say, because, I think as doctors, we have great agency. We're capable people and we are respected. Doctors and nurses are the two most trusted professions in this country. And so when doctors and nurses say things or act in, climate positive ways, that impacts on our communities, and our communities can go, okay, well, if they're saying it, that's a fair thing, that's true. My fundamental message, right, the fundamental thing is that climate change is a health issue, and therefore as doctors, we need to treat it just like we treat everything else, and that there are lots of modalities available. There are things that we can do, and we touched on some of the things today about greening general practice or reducing the carbon footprint of healthcare. Certainly in DEA, we have a number of special interest groups that look at things like mental health, sustainable healthcare, plastic waste, pollution, as well as campaigns. And so we are looking at the various different levers that we can engage as working doctors to make a difference to Australia's response to climate change, and also our preparedness as doctors for what we see as an increasing problem. I'd like to ask people to join DEA if they have capacity. Doctors for the Environment, we're 2,000 doctors volunteering our time, doing the best we can in light of this big problem. It's only $100. It's not a huge impost on people's pockets, but, certainly our members make a huge difference. Some of our members, it's their membership that is the difference. And obviously we're a not-for-profit group, so it's all about, we do a lot with meagre funds. That's the best way I can put that. So, would like to put that out there. Yeah, but fundamentally, I think doctors are a very capable group. And if we turn our, collective consciousness to addressing something that is the greatest health problem facing humanity and will be more and more laid at our feet over time, I think we can make a tangible difference, and we have an ethical responsibility to do it.
Kate, your invitation for doctors to join DEA is so important, because there are clearly two types of us, aren't there? One, are really passionate, wanting to do something, by wanting to find an instrument or a vehicle or an organization to actually do something. you're there. But there are a lot who are, as you said, overwhelmed, feeling impotent, feeling disempowered, feeling like they just want to give up because I'm only one little person. You're saying, no, 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 you matter. Join us. You will be part of a big movement that will work together because climate change is a health problem.
Completely agree.
It has been such a pleasure to speak to both of you, Kate and Simon. Thank you for your time, and thank you for taking us through a very difficult issue, but making it more and more practical as it goes. And I hope that we will have a lot of voices speaking up for this issue amongst the GP community.
Thank you so much, David.
Thanks, David. Thanks, Kate, as well.
Yeah, thanks, Simon.
Thank you for listening. Visit healthed.com.au to create a free account and claim CPD for podcasts like this and access a record of your learning. Subscribe to the show on Spotify or Apple Podcasts for weekly episodes on a range of clinical areas relevant to your ongoing practice.